Well, during the protests that we're seeing this week, a professor who studies the effects of tear gas says using it could spread COVID-19.
He says it could cause a second wave. KIRO 7's Allison Grandi talked to the Duke University researcher who thinks law enforcement needs to stop using it to stop the spread.
Protesters shoulder to shoulder and shouting. Don't shoot! Don't shoot! Many wearing masks, but not all of them, and not all of the time, has researchers worried about the spread of coronavirus.
People being so close together in these very tense situations, shouting, being very close can transfer the virus much more efficiently if someone has an underlying infection.
Sven-Erik Jord is a professor of anesthesiology at Duke University.
I'm very concerned that the mix of crowds that are close to each other and tear gas can catalyze a second wave of COVID-19, make it much worse than we thought before.
He says it's the use of tear gas that takes this to a whole new level of risk.
We are concerned that the tear gas exposures can make this worse.
Jord has been studying the effects of tear gas since the early 2000s. He says the only safety data for tear gas is from studies done 50 to 60 years ago, using lower concentrations on healthy members of the military or law enforcement, not a diverse crowd you see filling the streets to protest. Seeing clouds of tear gas night after night across the country has him sounding the alarm.
Tear gas are usually solids like powders that are dispersed or droplets. So when these are depositing in the lungs, they can cause local injury and inflammation, and then can make the lung more permeable to viruses and other threats.
He thinks law enforcement needs to rethink the use of tear gas, especially as more than 106,000 people have been killed by coronavirus in the U.S.
It's really stunning the level of use in the context of COVID-19 epidemic, that there was no thought about this before at law enforcement and other federal and local institutions about the potential threat with the mix of COVID-19 that these weapons might pose.
He'd like the CDC to study the long-term effects of tear gas on the spread of coronavirus and the impact it has to a diverse crowd, people of different ages, races, and medical conditions. Allison Grandi, KIRO 7 News.